Bismillahirrahmanirrahim. Assalamu alaikum, my dear students. Hope that you all will be fine. Now again, the continuation of the lectures regarding the topic that is the gastrointestinal drugs, in which we have completed almost various topics, but again there are 2 or 3 topics left. Now today we are going to discuss the emetics and anti-emetics under the same heading, that is the drugs acting on the gastrointestinal tract. Now emetics and anti-emetics. What do you mean by emetics and anti-emetics? Emetics are those drugs which can be used to cause the process of vomiting or to vomit. They are known as emetics, and anti-emetics are those drugs which are used to control that vomiting, so they are known as anti-vomiting. Now we are going to discuss in detail about these vomiting and anti-vomiting drugs, or emetics or anti-emetic drugs. So this is the topic, that is gastrointestinal drugs, emetics and anti-emetic drugs. Now before going to discuss in detail, you must be knowing that this process of emetic is under the control of the nervous system, and also because in the nervous system, in the brain, there are certain centers which are responsible for the process of this emetics. That is, the most important is the center of vomiting, and next is the chemoreceptor triggered zone. So these are the 2 most important centers which are responsible for the process of emetics as well as anti-emetics. That is, emetics to vomit, and the anti-emetics to control that process of vomiting. Now what is vomiting? Vomiting means that nausea and vomiting, they are the unwanted side effects of many clinically used drugs. You know that the vomiting usually takes place either due to certain poisoning compounds when it goes into the body, due to the disturbance of the GIT, due to the poisoning drugs, due to the side effects of certain drugs which are clinically used, that is particularly the chemotherapeutic agent used in the cancer therapy. Now chemotherapeutic agents are those chemical compounds in the form of drugs which are used during the chemotherapy. Now what is chemotherapy? You know that the chemotherapy is the use of the drugs which are responsible to treat the cancerous or the tissues, and the side effect these chemotherapeutic drugs is the vomiting. It is the vomiting. So that vomiting produced by the chemotherapeutic agents that is used in the cancer therapy. Now there are other drugs causes this type of condition, that is known as opioids, general anesthetics. You know that general anesthetics are those anesthetics which are given to the patient prior to the surgery, and these general anesthetics, they are having the effect on the central nervous system, and they cause the suppression of the centers, and these general anesthetics also responsible for the cause of vomiting, or the emetics. They act as emetics. So general anesthetics, then digoxin, you know that these are the cardiotonic, and they can be used in that case of where there is requirement to improve the power of the muscles of the heart. They are known as cardiotonic. So digoxin, these are the drugs. They are also having the side effect known as vomiting or the emetic effect. Motion sickness means the traveling sickness. When the person travels, and some of the person, not all, some of the person, they are having this motion sickness because when they travel either by road or by air, due to the air pockets, some passengers, they start vomiting, and that type of vomiting, that is which arises during the traveling, is known as motion sickness. Also causes the nausea and vomiting. So next is the early pregnancy, that is first trimester, is that is the early pregnancy. So in this case again there is process of vomiting or emetics. Migraine we have discussed in our previous lecture about the migraine. So migraine is that condition in which there is a certain part of the brain or the head having the pain, severe pain, that is known as migraine. In case of migraine, there is also the process of vomiting takes place. Now, bacterial and viral infection. This bacterial and viral infection usually takes place in the GIT. So when there is bacterial or viral infection in the GIT, they may cause the process of vomiting. Now, there is schematic diagram of the factors involved to control the vomiting and site of action of the anti-emetics. Now, this figure shows that how the emetics takes place and where the anti-emetics can act. Now, this is the brain. In green color, it is the brain. Now, red color indicates the part of the brain that is higher cortical central. The higher cortical central, this is the higher cortical center which is responsible for the pain, repulsive sides, smell and emotional factors. So this is the center which controls all these actions, that is the pain, repulsive side, smell and the emotional factors. Now again, there is vestibular nucleus. This is the vestibular nucleus. It is also that part which is having the effect, we show the effect of emetics, and also there is anti-emetics can act upon that. Now vomiting center, that is vomiting center, this is the vomiting center. It is present in the hypothalamus of the brain. This vomiting center, when stimulated due to certain drugs or due to the certain virus or the bacteria, the impulses arises, act upon that vomiting center, and there is stimulation of the vomiting center. And when there is stimulation of the vomiting center, they may cause the vomiting. So again, the vomiting center, when stimulated, there is a process of vomiting takes place. Now this vomiting center is present in the hypothalamus. Now next is the central trigger zone. Central trigger zone is that part of the vomiting center which is responsible for the process of vomiting or emetics. So this is known as central trigger zone. This is known as central trigger zone. Now again the vagal, this is the vagal. Now vagal stimulation. Now vagal stimulation, you know that this vagal stimulation also responsible for the process of emetics, and then the suppression of this may cause the anti-emetic process, anti-emetic. Now again, that this is the stomach. You know that I told you in the beginning that there is bacteria, there are viruses, they can act upon this and they may cause the process of emetics or the vomiting. So the cells which are responsible for that, they are known as enterochromatin cells. Enterochromatin cells, right? Now this is that. Now coming to this side, that is antihistaminic H1 receptor, they act upon here, that is and they antagonize the process of that vomiting. Now next is the hyoscine. Now hyoscine, you know that under the heading of the parasympathetic nervous system, we have discussed this drug that is hyoscine, which is known as scopolamine, anticholinergic drugs. This hyoscine and scopolamine, that is these drugs usually act upon the M1 receptor, that is muscarinic receptor. So this hyoscine is the choice of the drug in case of motion sickness, that is known as scopolamine. And this scopolamine is used to suppress the center, that is vomiting center, and there is inhibition of the vomiting. So phenothiazine, then domperidone, phenothiazine and domperidone, both of these two drugs, they act upon the D2 receptor, that is dopamine receptors, D2 receptors. Metoclopramide, again it acts upon D2 receptors. So doperidone, haloperidol and galidinstrol, these are the drugs which act upon the D2 Whereas ondansetron is the drug which acts upon 5-hydroxytryptamine 3 receptor. Means that you know that when we were discussing about the serotonin, which is also known as the hydroxytryptamine, it is having one to the H124 receptors. So particularly H5 is also there, but there this effect shows, this drug shows its effect on 5-hydroxy-T3 receptors. Now that is known as ondansetron. Now 5-hydroxy-T3 receptors, 5-hydroxy-T3 receptors, they antagonist or decreases the activity of the vagus nerve. So we can see that they show their effect in the stomach, particularly on the vagus nerve, which supplies to the stomach. Now, nebulon, that is CB1 receptor. Now, what is CB1 receptor? CB1 means that they are the cannabinoid receptor. So, cannabinoid receptors, they are CB1 and CB2. Now, these receptors, that is, they help in they combine with the particular drug, and that is usually known as neuropathic pain. Because that is cannabinoid is the plant which used to induce the neuropathic pain. That is used in the neuropathic pain. So treat that neuropathic pain. So that is known as CB1 and CB2 receptors, right? Now this is the figure. Now coming to the next figure, how this process of the anti-emetics and emetics takes place. So major center and visceral structure involves in the emesis and neurohumoral receptors mediating emetic response. Now particularly this figure shows how the emetics takes place, or the process of vomiting takes place. Now this, you know that process of vomiting takes place by means of certain. Now coming to this factor, this point. Now because this figure shows the process of emetics, how the emetics or the process of vomiting takes place, which are the components, which are the receptor, which are the parts in the brain, in the GIT, which are responsible for the process of emesis. So emesis is the process that is there when there is starts of vomiting or the emetics. There is, the certain factors. First of all, gastrointestinal irritation. Now, gastrointestinal irritation means whenever there is irritation takes place in the GIT, there is arising of the impulses. That impulses enter into the enterochromatin cells. These are the enterochromatin cells. Similarly, chemotherapy, radiation, infections, and certain drugs. All these are the mediator of the emesis. They are the mediator of the emesis, or the components for the emetic process or emesis or the vomiting. So impulse arises from these components. This factor enters to the enterochromatin cells. Now enterochromatin cells, when they enters into these cells, they may cause the inflammation. Now inflammation we have discussed various time about the process of inflammation. That is, what is inflammation? Now whenever there is inflammation, there is release of the kinase. There is release of the prostaglandins. These kinase and prostaglandins are responsible for the process of the emesis, or they release during the inflammation. On the other hand, when there is inflammation, there is also release of 5-hydroxytryptamine, that is serotonin. 5-hydroxytryptamine, nothing but the serotonin. So there is release of serotonin. These kinase and prostaglandins, they act upon the blood vessels. This is the blood vessel starting from here to here. It is
the blood vessel. In the blood vessel, when they enters into the bloodstream, into the blood vessel, that is 5-hydroxytryptamine and kinin, prostaglandin, which are the inflammatory components. Then there is platelets, activating factors. So these all are responsible for the process of the allergy or the inflammation. Now here there is again this 5-hydroxytryptamine enters into the PAN. Now what is PAN? PAN is nothing but the primary afferent neuron. PAN is a sensory nerve neuron. PAN is a sensory neuron. That is nothing but the primary afferent neuron. Primary afferent neuron. It is released, and then there is activation of 5-hydroxy-D3R, which is known as STN. Now these factors, then again, you know that these factors are responsible for the activation, enters into the bloodstream, and activation of the process of emesis or the emetics are there. Process of emesis or vomiting is there. Now again, from this blood vessels, they enters into the brain cells, that is into this the part of the brain where there is various receptors are located, that is known as H1 receptors, then T2 receptors, 5-hydroxytryptamine 3 receptors, and muscarinic receptors. They are all located in a particular part of the brain where is a center that is known as chemoreceptor trigger zone. That is known as chemoreceptor trigger zone. Now, on the other hand, now you know that this 5-hydroxy-D3 are responsible to cause the process of emesis or the vomiting. That there are other certain drugs, that is cytotoxin drugs, levodopa, apomorphine, digitalis, morphine, all these drugs, they are responsible for the process of emesis, or the vomiting. On the other hand, now how these centers or how these receptors are stimulated is the chemoreceptor trigger zone. Starting from here, that is up to this is the blood vessel. From the blood vessels, they enters into this part of the brain. Now on the other hand, beside this, our ear is also responsible for the process of emesis. Now again, during motion, autotoxin drug or certain autotoxin drugs, they are responsible to affect on the inner membrane of the ear, when there is impulses arises from the inner membrane of the ear, then there is muscarinic stimulation of the muscarinic receptor. This muscarinic receptor causes arising an impulse. This impulse arises from the brain, that is, these impulses start coming from this part of the brain, that is from the CTZ, from the other part of the brain. These impulses arises into the medulla oblongata, This is medulla oblongata. In the medulla oblongata, there is the vomiting center. These vomiting centers are stimulated by the impulses, that is, these impulses coming from the brain, impulses coming from this the part of that is brain where the central trigger zone is there. Now, vomiting center when stimulated through these impulses. Now, beside this, that 5-hydroxy-D3, muscarinic and H1 receptor, they also gives the impulses to the NTS. Now, NTS and PAN, you have studied during the parasympathetic nervous system. So, they are responsible for the stimulation of the vomiting center, and then there is the process of emesis start. Now, this is actually the part of the brain that is known as cortex. In the cortex, there is medulla oblongata, there is central trigger zone, there is vomiting center, And this is again, now process of vomiting takes place. Here it is due to this, that these are responsible for to act on the medulla oblongata. In the cortex, this is the central trigger zone, and this is the ear. From the ear, there is the impulses arises during the motion or during the ototoxic drug, that is motion sickness, also responsible for the process of vomiting, which we have discussed. And this is the process of the initiation of the emesis or the vomiting. Now I hope that all the things must be clear to you, that how the process of emesis takes place, how the process of vomiting takes place, right? Now coming to the emetics. Emetics are the agents which are used to produce the vomiting. Now again, why it is necessary sometimes to use the emetics to produce the process of vomiting, to start the process of vomiting, why there is requirement of this kind of the drugs. So you know that those agents, those chemical compounds, those drugs which are used for the process of vomiting, they are known as emetics. They are known as emetics. So these are the agents to produce the vomiting. Now emetics are the agent to produce the vomiting. Emesis is nothing but the act of vomiting is known as emesis. So difference between emetics and emesis. Emetics are the drugs or the chemical agents which are used to produce the process of vomiting. They are known as emetics. Now what is emesis? Emesis is the act of vomiting. Now how the vomiting takes place, we just discussed in detail in our previous slide. That is in the figure. The act of vomiting takes place by the stimulation of vomiting centers in the medulla oblongata. There is chemoreceptor trigger zone is also present, which we have discussed in the figure in the previous slides. Now certain emetics which produce the vomiting, they act upon the central trigger zone. They causes the reflexly to produce the process of vomiting or the emetics or the emesis. The drugs which act on the central trigger zone to stimulate that and to start the process of emesis, they are particularly the apomorphine. Now what is apomorphine? Apomorphine is the agonist of the central trigger zone. Agonist means that stimulate the central trigger zone. It is known as agonist. And those which suppress the activity of the central trigger zone, they are known as antagonist. Now apomorphine is agonist, that is it stimulates the central trigger zone. So when there is stimulation of this center, there is process of emesis takes place or the vomiting starts. Now if it act reflexly, that is ipecacuanha effect reflexly because it stimulates the certain other causes the irritation. Due to this irritation that is particularly in the GIT, it may cause the indirectly or reflexly stimulation of the vomiting center present in the medulla oblongata, and then when there is stimulation of the vomiting center reflexly, there is a process of emesis takes place. Now these drugs used when vomiting required. Now why it is necessary to start the process of emesis? What is the importance of this? Because sometimes the person take unconsciously and unintentionally certain components, certain kinds of the compounds or the chemical agents that may cause the process that may cause the poisoning condition in the body. So they have to be removed immediately, and for the removal of these poison compounds, we have to take the emetic compounds. We have to take the emetics, which causes the process of vomiting. So these drugs used when vomiting required, example, ingestion of undesirable substances, that is poisons, when they are ingested by the person unintentionally, then there is the requirement of the process of emesis. So in this case, apomorphine can be used, that is, it is nothing but the derivative of the morphine. Apomorphine is a derivative of morphine. It causes the stimulation of the central trigger zone, and there is process of emesis takes place or the vomiting starts. So it can be given intramuscularly, subcutaneously, used as 6 milligram and act within 5 minutes. Now, what should be the precaution to use this drug? The precaution is this, that it should not be used in respiratory depression. It should not be used in respiratory depression because it is CNS depressant. So that's why it causes the depression of the respiratory centers. So that's why it should not be given in that condition. So ipecacuanha, the syrup effect 15 to 30 milliliter for adult and 10 to 15 milliliter in children and 5 milliliter in infant is required to start the process of emesis or the vomiting. Now all the emetics are contraindicated. So there are certain conditions in which we cannot give the emetics. So that condition in which where we cannot use the emetics, so that are known as the emetics are contraindicated in corrosive poisoning, that is acid alkalis, because in this case there is risk of perforation and injury of esophageal mucosa. Now perforation means when there is formation of the wounds, formation of the holes in the membrane of the stomach, that is mucosal membrane, that condition is known as perforation. So when acid and alkali is there is risk of perforation and injury of the esophageal mucosa, Second is CNS stimulating drugs poisoning. It causes the convulsion. That is involuntary movement of the muscles. It causes the convulsion. CNS stimulation drug poisoning. Kerosene or the petroleum poisoning. Unconscious patient. Now unconscious patients, you cannot give the emetics to unconscious patient because they are unable to vomit. So that's why unconscious patient should not be given the emetics. Now morphine poisoning. Morphine poisoning is also another contraindication for the emetics, right? So these are the contraindicated condition in which where we cannot give the emetics.